chance at life. You know, he just started talking and...
This is a story about a loving family, their baby boy, and a death that not even 21st century medicine can fully explain.
Banana, good, banana.
Sean Sweetman was a healthy 2-year-old toddler from Long Island, New York.
Sean was a true little boy. He loved nothing more than climbing and kicking the ball and playing, but he loved nothing more than being with Steve and myself.
Last February, Sean suddenly came down with a 104-degree fever and started vomiting, symptoms that did not particularly alarm his pediatrician.
They checked his throat, his ears, his chest, and they said it was a stomach virus, and just to keep him hydrated and give him the Motrin and the Advil, piggyback it, and just monitor him with his fluids.
The fever broke the next day, but Shannon and Steve's instincts told them something was still wrong, and Sean was taken to the hospital.
We lived literally 5 minutes away from the hospital, so I was like, you know what, let's just make sure he's hydrated and make sure everything's okay. His blood oxygen levels were fine.
All his vitals were cool.
All his vitals were good. He had no fever. It was, I think, 98.2. They didn't get his blood pressure because he was crying. The whole time we're there, he just kept on saying, home, home. He didn't want to be there.
What little boy would? An IV was inserted to rehydrate Sean, but he was still, as Steve tells it, out of it.
They brought the lady in to give him a chest x-ray. I picked him up, and he went limp in my arms. And then he went rock solid. And all the doctors and nurses came rushing in.
After an hour of doctors trying to resuscitate him, at the end, Steve himself, a firefighter, pumping Sean's chest to try to bring him back to life, he was gone. The Sweetmans left the hospital without their precious son and with little explanation for how he died.
I miss his smile. I just miss his smile.
The Sweetmans were later told that Sean had somehow contracted Strep A. That's the same bacteria that causes strep throat and is usually easily curable with penicillin. But in some 12,000 cases every year, Strep A gets into the tissues, the muscles, and then the blood. It's called invasive strep. Not only is it more difficult to treat, but in some 14% of cases, it kills. In April, another child in New York, 12-year-old Rory Staunton, died of toxic shock caused by invasive Strep A, believed to have been contracted through a cut on his elbow. Sean did not have a cut.
Group A strep on occasion can cause very serious infections and be very difficult to diagnose, even in the 21st century. This child likely had Group A strep in his throat, didn't cause much of a sore throat, but somehow it got down into his lungs, and it was this combination of bad pneumonia and a bloodstream infection that really caused his death in all likelihood.
Shannon is a trained nurse and now the mother to a 9-month-old baby who, aside from the photos, will never know her big brother. The feeling of helplessness the Sweetmans still feel is overwhelming.
I never even in a million years thought that my child could get a strep and get sick and then be dead within 2 days. I wish I'd known more about it.
What is known about strep is that it is spread from person to person, and there's no evidence that it can survive on objects. Dr. Schaffner, who did not treat Sean, says not even a strep throat culture would necessarily have detected the strep bacteria in his blood.
These are fortunately very rare events, but on occasion, it's a pediatrician's nightmare. They're doing everything absolutely correctly, but nonetheless, the infection proceeds and eludes their best diagnostic efforts.
Mercy Hospital, where Sean was treated, could not comment on his specific case, but in a statement on Group A strep said, quote, "It can be indistinguishable from a viral infection for which antibiotic treatment is contraindicated. In rare cases, by the time a child reaches a hospital emergency department, antibiotics may be ineffective, and standard of care treatment may not be able to avoid a fatal outcome in such scenarios." The best parents can do is exactly what the Sweetmans did, pay close attention to their child's health, and seek medical help assertively. And even that cannot prevent every tragedy.
From him not being here, just the silence is tough.
With Everyday Health, I'm Stephanie Sy.